The death of General Colin Powell is raising questions about the effectiveness of the coronavirus vaccine. We know that General Powell was fully vaccinated, but he also had underlying health conditions which likely complicated his fight against COVID. Dr. Praveen Buddiga is a board-certified immunologist. He's the one that we turn to, and we have all of these questions, and we certainly thought there were questions that were arising here. You've probably seen them circulating. Dr. Buddiga, thank you so much for jumping on with us. I know you're so busy. So, first of all, let's sort of set the stage about the health status of General Powell before his death. He had been ill for some time and had underlying health conditions, correct?
That is correct. Colin Powell was immunocompromised, and as a board-certified immunologist, I have many patients who are also immunocompromised. And although they have been vaccinated, they're still at risk. And I spend my day explaining the risk and how best to move forward in this world. And it's such a huge conversation that I have with patients. Although I don't normally like to get into the specifics of someone's personal medical situation, General Powell being a public figure, I feel comfortable saying that he was fighting a severe cancer of the blood and at the age of 84. Whenever you're fighting cancer, contracting COVID can be a very tough combination for the body to endure, even when vaccinated.
And that's the part that is so important for us to highlight, right? Because I think there's questions about the efficacy of the vaccine. Many people are saying, well, wait, he was vaccinated, so what's the point of getting vaccinated if he's just going to die? He was ill. He had this other issue that he was dealing with and was immunocompromised.
I believe 100% agree with you. I don't believe we should connect the loss of General Powell yesterday to the vaccine not being effective. The vaccine works, absolutely works. It's actually saved hundreds and thousands of lives. Colin Powell, unfortunately, had an underlying condition, medical condition, and severely affected the vaccine's ability to create an appropriate immune response to give his body proper defense.
So I guess the question becomes, if you are then immunocompromised, and I think the people that are have been doing their best to make sure that they stay protected, what extra steps can they take? Is it a reminder to sort of return to those things that we were urged to do at the outbreak of the pandemic?
That is correct. It can vary, but in Colin Powell's situation, as we know, his immune system was so weak from fighting the cancer that the vaccine was unable to trigger enough antibodies. The steps we can take is masking, staying away from very large social situations, and also washing those hands. Just the same things we've done before.
And I imagine, especially as the holiday season comes, those things are going to be important. If you are immunocompromised, you want to make sure to not let down your guard if you're going to be around groups of people, and I suppose vaccination status or not, right?
That's correct. We have to remember that the vaccine doesn't make you immune to contracting COVID-19. It stimulates a response in the body so you have a better defense.
Right.
From getting more severely ill and ending up in the hospital. So if you're vaccinated, you can still contract and transmit the disease. That's why it's so important to mask up, especially in this age group.
Yeah. How are you feeling about the booster shot for this immunocompromised group? Do you think that's going to help further protect them?
Absolutely. I believe in receiving the booster. I'm a strong proponent of the booster shot. It's a great way to reinforce your body's defense for this virus, and the medical community is highly encouraging those in this group to receive the booster for additional protection.
Let me ask you, we haven't talked for a while about this notion. We haven't even heard the term herd immunity in a while. Is it even an attainable goal anymore?
I honestly believe we still can do it. We're almost, actually, this is really surprising that the CDC reported that nearly about 290 out of 290 million Americans, 260 to 270 million Americans have already received the vaccine. We still have a goal of, we're currently at 190 million and 270 million have to get vaccinated. And that's the goal, actually. This goal is, I think, still attainable. The Immunology Committee is predicting we'll hit that probably by the end of the year. And I feel strongly that we can.
Dr. Buddiga, allow me to get a little personal. We have been talking to you since, I think, the very outset of this. You've been available to us here on Good Day LA. I certainly met you last October. You've been on the ground as a first responder fighting in this fight. And I just need to do a check-in on you, sir, because it seems like it's been a really long haul for you. How are you doing? This has been relentless for you.
Well, I appreciate you asking. The health of the caretaker is extremely important. We've heard about caregiver burnout being a severe situation, and especially healthcare burnout. And we have hundreds and thousands of doctors working day in, day out, nursing, health professionals, trying to take care of this COVID situation. And it's an ongoing relentless, it's almost like 2 years into the, and we hopefully are at the end of this third or fourth Delta surge that has really bogged us down. And I'm just trying to hang in there, and towards Christmas, and hopefully this will bring the booster and everybody getting the vaccination will bring an end to this. But to really, I believe the work of the Good Day LA, especially you, Michaela, in bringing this to light, to report the information about the effectiveness of the vaccine and how important it is to receive it, especially the booster, has actually saved millions of lives throughout the Los Angeles and Southern California. I'm so honored to be part of this, spreading the message to the community, because I think it's so important. And we've actually worked together, and I think we have saved millions of lives as the team of GDLA, and I appreciate that.
Oh my goodness. Well, I was trying to give you your flowers, Dr. Buddiga, and you know what I'm going to come over here and give you the safest hug I could possibly give you, because you know you're an extraordinary man, and I could feel the fatigue in you, and I just want to say, from one human to the other, we just appreciate all that you've done, and to work and try and save as many lives as possible. So hopefully, sir, you'll get some rest soon, okay? And maybe I'll be able to give you that hug in person one day soon, once all the boosters are done, and we'll get to have a chat about something other than COVID-19.
Of course.
Okay.
What's the latest movie coming up in Hollywood?
Exactly. I knew Dr. Buddiga would have some ideas about things to talk about. What podcasts you're listening to? A little bit of normal life. What a delight. Dr. Praveen Buddiga, a board-certified immunologist who has just been stellar to us. Thank you so much again for jumping on with us today.
Thank you for having me.
And do take care.